Hello, I'm Dr. Robert Bednarczyk, Associate Professor of Global Health and Epidemiology at the Emory University Rollins School of Public Health. I'm also a faculty member at the Emory Vaccine Center and the Winship Cancer Institute. I would like to welcome you to this session on best practices for HPV vaccination at 9 to 10 years of age. I have received research funding support from the National Institutes of Health, the National Vaccine Program Office, CDC, and the Bill and Melinda Gates Foundation. I have no other conflicts of interest to disclose. I would like to thank the staff of the National HPV Vaccination Roundtable, especially Jennifer Sienko, for all of the support and coordination to make this session come together. So in terms of HPV vaccine uptake, we typically see relatively low vaccination coverage among 13 to 17-year-olds assessed in the National Immunization Survey team compared to that of other vaccines. So as a point of reference for the Tdap vaccination, we're seeing coverage greater than 90% in that population, receipt of at least one dose of quadrivalent meningococcal conjugate vaccine at around 89%, but only 72% of 13 to 17-year-olds have received at least one HPV vaccine dose, with 54% of US adolescents up to date for the HPV vaccine series. That up-to-date level is very similar to the coverage seen for 2 or more doses of meningococcal vaccine at approximately 54%. And it's important to know that that recommendation for the meningococcal second dose came about only in 2013 and is recommended to be given at age 16. So there's even less time for catch-up, but we're still seeing coverage levels for that vaccine similar to that for HPV vaccination. So the recommendations that we have currently for HPV vaccination in the US coming out of the CDC and coming from the Advisory Committee on Immunization Practices read that children and adults aged 9 through 26 years of age are recommended for HPV vaccination, with a routine recommendation at age 11 to 12 years, and also an indication that vaccination can be given starting at 9 years of age. But the wording of this recommendation in a way almost makes this sound like an optional starting point. However, other professional organizations, including the American Cancer Society and the American Academy of Pediatrics, routinely recommend HPV vaccination between the ages of 9 to 12 years. When we look at coverage of HPV vaccine by 13 years of age, where we should expect to see coverage based on these recommendations. Some prior work that we've done shows how we're falling behind. So when we look at the 2016 NIS team data for all 13 to 17-year-olds, only 37% had initiated HPV vaccination prior to 13 years of age, and only 16% were fully up to date by their 13th birthday. So our young people are not being vaccinated fully in accordance with the existing recommendations. Another recent study that was just published in Pediatrics this month focused in specifically on the 13-year-old cohorts that are assessed in the National Immunization Survey team. And they evaluated initiation and completion of the series at ages 9 to 12 years. And interestingly, while they found a consistent increase in initiation at 9 to 12 years of age for these 13-year-olds, coming up to greater than 60%, completion, being fully up to date with the HPV vaccine series, has stagnated at around 32%, and it's stayed that way since approximately 2015. So why is it important to vaccinate adolescents starting at 9 to 10 years of age? Well, the ACIP recommendation does include this as part of their recommendation, and vaccination starting at 9 years of age is routinely recommended by American Cancer Society and the American Academy of Pediatrics. Vaccinating early may preempt some parental concerns about sexual activity, As parents of 9 to 10-year-olds may be less concerned about the vaccine increasing levels of sexual activity than they may be for adolescents who are aged 11 or 12. And starting HPV vaccination at age 9 can also address parental concerns about the number of shots at one visit. For example, some health settings are giving the first dose of HPV vaccine at 9 years of age, the second dose at 10 years of age, and then following up with the Tdap and quadrivalent meningococcal conjugate vaccine at 11 years of age. So today, we'll hear from 3 leaders in this area of HPV vaccination starting at age 9 to hear about the current state of research and implementation on this very important topic. Dr. Rebecca Perkins is going to give us a little bit more of an overview of the situation, including outlining the components of a successful program to vaccinate starting at 9 years of age. Dr. Melissa Gilkey will speak to us about primary care professionals' perspectives on starting HPV vaccination at 9 years of age. And Dr. Sherry Zorn will share some of the successful clinic level experience that she has seen in her clinic with starting HPV vaccination at 9 years of age. So with that, we'll move on to the presentation from Dr. Perkins.